Hello friends, coming to the next topic, thrombocytopenia in pregnancy for part 3 mrcog, a quick revision. A patient discussion task, a 33 weeks pregnant lady, second pregnancy, referred by midwife with a blood investigation showing serial decrease in the platelet count. So she has come. So how we are going to deal this patient? So you can see this is a pregnant lady and she has come with a thrombocytopenia. So first of all, after introduction, we have to confirm the name and age of the patient. We can ask her what she would like me to address you. Then put an agenda that I can see that you are here today. You have been referred by the midwife because you have got some concerns with your blood reports. Is that right? Has anyone told you about anything about the blood tests? Okay. So I'm here to help you and address all your concerns. Prior going with the discussion, is it okay if I ask you a few questions? Do you have any particular concerns or expectations from today's meeting? Like that we can go. Now what are questions? So this is a pregnant lady. So first thing we can ask, how was your pregnancy so far? Was it a planned pregnancy? And how was there any complications? Any bleeding, any pain, any leaking? How is your baby doing? Have you named your baby? How is your baby moving? Okay. Now coming to the thrombocytopenia questions, specific questions to thrombocytopenia. We can ask whether you had any bleeding tendencies in the past, like bleeding after dental extraction, bleeding from your nose, from your gum, any red spots on your body, bleeding through your urine, bleeding from bowel, like that we can ask. From bleeding from your back passage, bleeding with your waterworks, your urine, that also we can ask. Now just think what are the causes for thrombocytopenia. One is previous history we asked. Now the second is with some viral fever we can have thrombocytopenia. So we can ask whether there is any fever with rash. Now, which condition in pregnancy can be associated with thrombocytopenia? High BP. So that also we can ask whether there was any high BP recording in your pregnancy, and whether there is any high blood sugar, any growth concerns in your baby has been told to you. Like that we can ask. So these are some of the specific questions related to thrombocytopenia. Okay. Now we are going to the rest of the history almost like the same. So now we are going with the rest of the history. Here we can ask how was your periods, whether there was any increased bleeding or not. That also just we can ask about smears. Then we can ask, can you tell me more about your previous pregnancy? Then mostly she will tell, in my previous pregnancy I had a high BP recording. Then we can ask, did you have any medications, and whether low platelet count was there at that time? Was anything told about that? And how was your delivery? Was there any complication? Then she may be telling, I had some bleeding in the last pregnancy which was medically managed, and we can ask whether any need of blood transfusion was there or not, and how was your subsequent BP? That also we should ask. Your subsequent BP recording, how was it? That also we can ask. Okay. Now coming to also we can ask, what are you planning for future pregnancies? Because in gestational thrombocytopenia there is a recurrence rate is there. So are you planning for future pregnancy? That question also we can ask. Now coming to routine, any medical, surgical, allergies, medication. This is important. There we have to specifically, if she's not telling, we can specifically ask, are you on aspirin? That we can ask. Okay. Then about smoking, alcohol, recreational drugs, weight to height ratio. So in this scenario she is telling the weight to height ratio is 35. Blood group, reservation for blood and blood products, support at home, are you feeling safe at home, what do you do for living, mental health, do you feel low, down, depression in the recent past? And we can thank her, thank you for giving all this information. Do you feel anything else to be added to this? Now I need to examine you in the presence of a chaperone with your consent, and just to check your blood pressure, and also urine protein, and your tummy, to know your growth of your baby. Okay, is it okay for you? Okay. Now, coming to your blood report, I have confirmed your name with and NHS number. So, the report is showing, as you have told, the report is showing that there is a serial reduction in the platelet count. So, I will be discussing you in detail. So, this platelet count are cells in our blood which helps in clotting. Now, you can remember the further discussion as 3C. 3C to remember. One is cause, other is care, third is concern. Okay, so coming to the cause, we can say that this condition, there are many causes for this condition. One is pregnancy related platelet count reduction can be there, which usually occurs in pregnancy in a mild state, and it is not going to affect you or your baby. If it is not going to affect you or your baby severely. And the second is immune mediated, ITP, what we call as ITP, or antibody mediated. That is, antibodies are certain proteins that can attack our own cells. So it can attack your platelet count and causes reduction in the platelet count. Okay, are you getting me? Okay, and the third one is associated with high blood pressure, and for HELP syndrome, where there is high BP and abnormalities in the liver enzymes as well. So we need to monitor your blood pressure, urine protein, and also your liver function tests. If there is any abnormality, we may be looking your coagulation test, clotting test as well. Okay. Now coming to your care. So your care will be in a consultant-led unit by a team of doctors, including our consultant, the blood doctors, the sleep doctor, anesthetist, and the baby doctor. Specialized midwife will be there to take care of you, and your platelet count will be serially monitored. And if your platelet count is reducing, very much reducing, sometimes we may have to give you an injection called injection steroid, or sometimes immunoglobulin injection to boost your immunity. And if it is severely reduced, sometimes after discussing with your team, with your blood doctor, sometimes may have to start platelet transfusion as well. Are you getting me? Okay. So we have discussed cause, we have discussed care and monitoring, and in the care we can tell that so your delivery has to be in a consultant-led unit, and the major concern during your delivery is that of bleeding that can occur even before delivery, at the time of delivery, even after delivery. So since you had a history of bleeding in your previous pregnancy, we have to this time the bleeding risk can be more increase. So I'm telling this not to worry you, and we are here to help you and support you. We will take all measures to prevent increased bleeding. Our senior doctor will be there to take care of you, so don't worry about that. Okay, and we will be arranging adequate blood for you. In case bleeding occurs, we may have to start blood transfusion as well. Are you getting me? And the next concern is about the pain relief medications during your pregnancy time, during your delivery time. That is, when your platelet count is reducing more than 80, then we may not be able to give some pain relief methods like epidural. The anesthesia sleep doctor will be, pain doctor will be discussing you about the options you can have during your pregnancy soon. Okay, so we have discussed cause, we have discussed care and monitoring, we have discussed the concern. So now what we have to discuss from the history, we got the low platelet count that we have mentioned, her increased risk of bleeding we have mentioned. Now her weight to height ratio is 35 from the history we got. So about that we have to tell. Also I have a concern about the increased weight to height ratio of yours. In pregnancy, most women with increased weight to height ratio pregnancy can have a straight outcome, a smooth outcome. but sometimes, however, it may be associated with some complications like increased blood pressure. So we'll be monitoring your blood pressure, your urine protein regularly. Special cuffs may be needed for you to measure the blood pressure. Okay, and there's increased risk for clot formation. So after assessing your risk with a hematology doctor, sometimes have to start blood thinning agents after delivery, but in your case only after discussion with the hematology doctor we will be taking the decision of starting the blood thinners, as you have there is increased risk of bleeding because of the low platelet count. So that we have to say. Then risk associated with the high BMI, what all, there is increased risk for pretty delivery, increased risk for cesarean section, and increased mental health problems can be there. Okay, so so we have mentioned that also. Now coming to the baby, we have to explain. So now concerning about the baby doctor will be taking care of your baby once the baby is born. And sometimes if it is a immune mediated platelet immune mediated reduction in the platelets, sometimes these antibodies can from your blood can reach to the baby's blood and can destroy the baby's blood cells as well. So it can cause bleeding in the baby during the delivery. But it is rarely occurring, rare. So when your platelet count is less than 80, the baby's cord blood may be taking and checking for platelet count, and serial monitoring of the baby will be done first day, fourth day. And if baby's platelet count is reducing, sometimes may have to, after discussion with the specialist doctors, may have to consider giving steroids, immunoglobulins. Sometimes if serious, may have to consider platelet transfusion as well. Also, usually in delivery, sometimes you may have to use instruments to cut short the delivery. So during the deliveries, we will take extra precaution not to use these instruments, blood sampling from the baby, because that may cause bleeding in the baby's head. And if baby's platelet count is reducing, sometimes you may have to do ultrasound and scan of the head as well, to know if there is any bleeding in the brain as well. Now coming to the concern of aspirin, that we have to say. So I can see that you are taking aspirin. So after discussion with the specialist doctor, we may have to consider stopping the aspirin, because that further increases the risk of bleeding. Okay, and also coming to the future pregnancy risk, also we have to tell. Now after the delivery, you may have to repeat the blood platelet count by 6 weeks, because if it is a pregnancy related, that can come back to normal by that time. And there is a small risk of recurrence in the future pregnancy also. So I think I have given you a lot of information. I will be giving you the written